welcome to the Pause It podcast. I am Dr. Sam, and with me, as always, is Dr. Robert. How are you doing, Dr. Robert?
Good, Sam. How are you doing today?
I'm doing great.
Yeah.
Having
Anything
a
fun or
fun
exciting in your
day.
week? Yeah.
Huh?
Anything fun or exciting in your day?
Oh, well, we had a really busy day. Thursdays are my day off. So once again, we've had a crazy day of trying to get stuff done. We actually had new countertops put in, which was pretty cool.
Oh, nice. I know you said you planning on trying to get that. I think at last week's meeting. So that's good to
Well, yeah.
see. That's moving forward. Very
Yeah.
cool.
I painted all my cabinets myself. So,
See, we'll post pictures later of everyone so you can judge how well Dr. Sam does at painting. So
oh, yeah. Just imagine it was beautiful. I did a wonderful job.
with your type A personality, I'm sure they were stunning. So I'm probably the same way.
Yeah.
I'm like, I'm gonna make this perfect.
Oh, I know. Well, that's why I was like, I gotta do it before the countertops come in, because otherwise,
Yeah.
if anything gets on them, I'm gonna be like, ooh. So yeah, so it's pretty fun.
That sounds
Pretty cool.
cool. Awesome. Very exciting. So I think yeah, and then now we're getting ready for our first conference next week. That's a big thing for everybody. So,
Yes,
you're a veterinarian or in the veterinary field, join us at the vet show in Chicago next week. We're very excited. Got a lot of things going for the myBalto Foundation. And
definitely.
yeah,
If
so it's
you're
been
gonna
pretty
be
good.
there, come find us and come talk to us.
Mhm. We have cupcakes.
Yes, we are bringing cupcakes. We know that veterinarians love to eat, and so
Mhm. It's like, it's the best way to get me to focus. It's so true. Like, give me food and I'll pay attention.
yeah, exactly. It like we just had a patient that was in our clinic for a while, and the owners brought crumble cookies for us.
Oh,
I was
I
like,
love those.
they're so good.
They're so good, but so bad for you,
Everybody
but so good.
so bad for you. I mean, but they're so good. And so like everybody was just like it just made everybody's day. So I was like, yeah, she's a nurse, she knows. Probably the
That's
same for
exactly what it's
them.
like. No one ever brings veggie trays, though. That probably wouldn't be a bad idea every once in a while, especially during the holidays. Like, I appreciate cookies, but I'm pretty sure I'm this close to diabetes, like, several times during the holiday season.
During the holidays. Although I
Yeah.
love a good veggie tray. I'm not gonna lie. I mean,
I
sometimes
do
like
too.
we get birthday treats, and like I kind of get
Yeah,
excited when somebody's like, I kind of just want a fruit tray and a veggie tray because like we just have so much crap. I just want something good. I'm like, yeah, it's great.
I feel the same way, and this
Yeah.
might be a good segue actually into our topic today with food. So
Yes. So we're doing part 2 of the allergy kind of discussion, being that we're seeing a lot more allergies this time of year, but then again, too, with you, it's kinda all year round. But that is some part of it that we really should talk about. So, like, all year round, the 2 other things that we really didn't, I mean, we may hit on them for a second, but we really didn't talk about it too much, is not well, we talked about environmental allergies last time. And then this time we're talking about food allergies
Mhm,
and flea allergies, right? So,
mhm.
I mean, the flea one's pretty simple.
Yeah, you
Your
have
dog on
fleas.
preventative.
Yes, pretty straightforward. It only takes 1 flea bite, so it's actually very important to keep
Really
in mind.
doesn't take much. But the other thing too is like, especially with cats, like we were saying last time,
Mm,
cats, you will not find it most of the time unless you have a cat that is just ripping themselves to shreds or is infested with fleas. You won't find them. But I can't tell you how many times people are like, "Oh, they have a tapeworm," or and I'm like, "Well, get them back on flea
problem.
preventative." You know?
Yeah, that's a big thing for owners to know. If your cat or dog has tapeworms, a lot of times they're secondary to fleas.
Yeah.
So it's
More
something to pay
often than
attention
not, unless they ate an animal that had fleas and
to. Yes.
then they got them because
Yes.
they don't jump from one animal to another. Like you have to ingest them, and then
Yeah.
it's very gross.
It's very gross. I
Yeah.
don't get it sometimes, but parasites, love them.
I know, and the thing is, I always remember being like, "I'll be able to look this up one day," but there's a few that I know very well because we see them all the time, and tapeworms are definitely one of them.
Mhm. And fleas are just such a pain to get rid of. Like, not only do you have to treat your pet, but then you have to treat your household and where you
Yeah,
live. And if you have carpet, God help you, and you're
yeah,
washing everything, and it's such a process. And even with like flea preventatives, a lot of times they kill certain cycles of flea. They don't kill every stage. So you have to like vacuum up all the larvae and the carpet, and it's not a fun
and
process.
honestly, even if you don't like, if you vacuum and you're doing a really good job of decontaminating, but you leave the vacuum, like the contents in the vacuum, you're
Mhm.
going to have fleas again. Gotta get it right outside. Like, and the other thing is bombs, like those bombs for your house, like they don't
Oh
work
yeah.
at all. They go up in the air. They don't get to where things need to go. If you are like needing to treat your house, you have to use the spray.
Yeah. That's why I use, back in vet school, actually, one of our colleagues brought their dog over to our house, and their dog had fleas, and therefore, all of our dogs had fleas.
I
So,
don't think I know who this is.
I won't call this individual out on a public podcast, but, I'll tell you after the
Yeah,
podcast.
I wanna know. That's crazy. Oh, I'd have been so mad.
We weren't thrilled, but, fortunately, we were very aggressive in the flea treatment of the house, but it sucks, like, from personal
It really
experience, it's
does.
not fun. You really have to wash everything, and it's just not a fun process.
Yeah, oh, it's awful. And you really have to keep them legitimately on preventative for 3 months before it's clear. If you
Yeah.
stop it, if you miss it, you are going right back to square one.
Mhm.
And sometimes when the infestation's bad enough, you can't wait the full month before you give that next dose. Like, because things can start to wane towards the end of the month a little bit with certain
Mhm.
preventatives. And
Yeah.
so like especially when I have like cats that are really like just a bad infestation because they have a lot of cats or whatever, and everybody has to be treated. You can't have a dog with fleas, treat your dog, clean the house, and not treat your cat because they'll
Yeah.
all go right to the cat. So you
Mhm.
absolutely have to treat everybody involved. Every person has to be on board, and you have to wash everything that can be washed, vacuum everything that can be vacuumed. Like, I mean, it's awful. It's really awful.
Yeah. Yeah, it's pretty horrible. I do not wish that upon anyone. It's kinda like lice for kids, I guess, but
That's what I was thinking too. I was like, it's kind of like lice. I mean, like it's just a production. And then with cats, like what I have seen is like when there's so many and there's just so many fleas, they're just everywhere. Even with really, really effective decontamination, sometimes if you don't like give the revolution or whatever you're using like every 3 weeks for the first couple of months,
Mhm.
nope, not gonna happen.
Yeah, and even if you have that bad of a flea infestation, especially in young animals, but particularly cats, you can even get what we call flea bite anemia, which means, like,
Oh
so
yeah.
many fleas are biting them that their red blood cell count is going down, and they
Oh
sometimes
yeah.
will need a transfusion. Happens a lot like kittens, unfortunately, because they already have a lower red blood cell count, and it's sad,
Or
so
really old cats too,
Oh,
right? So,
yeah, yeah.
like, the really young, the really old, because I
Yep.
did actually have, like a first visit with a cat that we ended up, like, tons of fleas, and the
Uh,
cat just was very weak and, like, wasn't doing very well, and we did blood work, and I was like, "Oh my goodness." I was like, "I think this is flea bite anemia." Like, it was
that's crazy.
so low that I was questioning some other things, but everything else was normal, so I was like, "This is
That's
not
crazy.
good," Yeah.
Huh, well, see, there you go. So keep them on lifelong because it's worth it.
Yeah, and actually the cat ended up doing great. Like once they got things under control and was feeling better, cat did great. So it wasn't
Yeah,
even.
it's a fixable thing. It's just annoying, and it feels like, I don't know, just one of those things where you feel like they're crawling on you afterwards. I don't know
Yes.
why that always happens. They're not anywhere near you, but you're like, "I swear they're on me right now." In the
Mhm.
clinic, it's not my favorite.
Yeah. Oh yeah. And I do think that people also like I have heard people like so try to say like, well, my dog didn't have fleas till they got here. It's like they didn't get fleas here.
Yeah, yeah, I guarantee that didn't happen.
I will say like our clinic is diligently cleaned. Like
Oh, yeah.
extremely clean. And
Oh,
we're very careful about cross contamination and things like that. If we like, they're not getting in with us. That's for sure.
especially after COVID, I feel like the protocols that were, like, not that they shouldn't have, not that they weren't clean beforehand, but, like, it went up to, like, the next level with COVID because I feel
Hmm.
like there's cleaning all the time. We're keeping ourselves clean. We're wearing masks. It's just like everything was decontaminated all the time. So it
Hmm.
was probably good practice for the profession as a
Hmm.
whole.
Yeah. Oh yeah. Yeah. So that's our PSA on fleas.
That's all
So
we need to cover.
definitely, but also too for your dogs that are and cats that are allergic. I mean, it's such a fixable thing. It's such an easy thing. There is expense. There's for sure expense, but there are ways to do it in a more cost effective way. Like not everything is super, super expensive. And there are some things that are very, very like they do work.
Mhm.
Like I don't tend to be a fan of any kind of a flea collar because most of them don't work, except for
Yeah,
the Seresto collar. I think that one actually genuinely does work.
really. That's the one area I'm a little less familiar with because I can't even remember all the new products that have come out because I haven't prescribed them in such a long time. Like I know I
Mhm.
use NexGard for my dog, but
Right.
I think Next, but I'm not this is not advertising for NextGuard, just saying that's what I use for my dog.
Yeah, yeah.
Um,
One
but
of the
there's a
oral
couple.
ones, it's one of the oral ones, but there's 3
Yeah,
so, like, 3 of the different companies have one. So,
yeah.
like, there's the NextGuard, the Empirica, and then Elanco has one too. I think it's called Credilio.
Oh, yeah, I think you're right. But
Mhm.
I think I like the oral ones better just because 1, I think they're easier
Yeah.
to give. It's so more
Oh,
the
yeah.
nice thing about phones is you can sit on your phone these days, and it's just like, "Give me a monthly reminder, taking my pet their flea and tick," and
It's literally
that's
how I have to remember to do it. Even though
yeah.
I tell people all day, every day to do it,
Mm,
I will forget my own dogs. So,
mm,
I mean, I my phone will yell at me beginning of every month, "Go ahead and do it," because that the only way I'll remember, for sure.
yeah. No, I think that's a thank God for phones. Honestly, I couldn't get around without my phone anyway, so it's good to have.
No, it reminds me of everything. And then but there are some topical options that are pretty good for flea and
Mm,
tick. But I definitely agree with you. Like I think the orals are way better. They kill things a lot faster. They actually have a safer therapeutic margin than the topicals, which I don't think most people realize. I think most people think just inherently partly maybe because they've been around a bit longer, so people are super
yeah,
comfortable with Frontline or Vectra or whatever else, Advantix, like some of those other ones.
yeah,
Um, and I mean, and then there's generics of all of these, right? So like Pet Armor or whatever else. Um, the front lines I have seen a little bit of like resistance to, I will say. Like I every once in a while will see like, oh, they just it's not working. So
yeah. It's an application issue too, I feel like sometimes because like,
it might
I don't
be,
know.
yeah, that's
I
true.
think
It could
yeah.
also be a bath on either side of it too soon, like
Mhm.
3 days before, 3 days after, then you can end up having some trouble with that too.
Yeah, that's good advice to give because, yeah, I feel like it's not as effective sometimes. I don't like the topicals. Just
Yeah. No.
yeah,
And, also, like, I mean, things can happen. I mean, some dogs, like, we're talking about allergies, and this is more of like an allergic reaction, but they can. I have seen, Phoebe actually couldn't there was one that she couldn't use. It just for whatever reason, she would get like almost like she would act like it was almost burning her. Like it was
mm,
fine, nothing happened to her, but her reaction to it was just like, oh, it was horrible. She would like roll on her back and I mean, it was terrible. So
mm,
I just stripped it off of her with some Dawn dish soap and just never used it again. I mean, I use a different one, but like, and I
yeah,
don't want to say which one because I don't want to like say that because there's nothing wrong with it inherently. It works for
yeah,
many other dogs and it's perfectly fine. But it just for her, it just didn't agree with her. And that's okay. That happens sometimes. You can have hypersensitivity reactions. That doesn't make a product inherently bad. Just like with the Next Guards and the Simpirica and all that stuff, like if you have a dog that has seizures, they don't cause seizures, but
they lower the
we
threshold.
take caution, yeah, with
Mm,
those guys because we know it can lower the threshold. So, but overall, as a safety margin, it is definitely therapeutic. There's a wider therapeutic range of how much they can get before it becomes harmful, and so I
yeah.
think that that's an important thing to know.
Mhm, yeah, every dog's different, just like vaccines too. Some
Mhm.
dogs are affected adversely, some aren't. So it's, I think you gotta do what's best for your dog or cat, see what works for them, and then, what you can stick to at the end of the
Yeah.
day.
Oh yeah. And I think we talked about it before that like there's nothing any good doctor is going to admit that everything we do is a choice, right? It's a risk versus benefit. What is the risk that they're going to end up with fleas and get some sort of either, flea allergy dermatitis and rip themselves to shreds or some other like tick-borne disease or you know what I mean, something like that, which are real and they cause problems and they can cause severe problems. I've seen some horrific tick-borne diseases. And even, I mean, sometimes I mean, there's lots of different things that can come secondary to that. So like, you have to make a choice. Obviously, you
Mhm,
don't want to do something dangerous for your dog, but that's why there's so
yeah.
many different options.
Yeah, no, that's it. I think that's the best part about it. There are plenty of options, you gotta find what works best for you and your pets, so that's the advantage of, capitalism.
Yeah, there you go.
Uh,
um, and so I think that's probably for flea and tick. Just keep them on flea and tick prevention.
Minimums.
That's
Yeah,
pretty easy, pretty simple. Um,
you would think.
yeah, you'd think, but I mean, again, we are sensitive to the cost of stuff, right? So I mean, we do understand that. But again, there are generics of everything and there is a way to do it. So just talk to your veterinarian for sure. Shampoos don't work. like, to control them, and, neither does, like, garlic or essential oils or any of that stuff. I'm just gonna say it. It doesn't work. Don't do it. It's ridiculous.
And I will second that statement.
And I'm sorry, but if somebody disagrees with me, come at
I
me.
Come at me, bro.
I've seen it fail. I've seen it
Yes.
fail. That's why I'm like, "Don't do it."
I think those things can help. Not the garlic because it's bad for your dog in the first
Yeah,
place.
garlic is bad for your dog.
But bad for your dog in the first place. So
Toxic.
I'm sure
Okay.
there's alternative options that are helpful, but they're not the primary way you should treat them. Put
No,
it that way.
because like, honestly, I think the flea and tick I feel like the flea and tick shampoos, they're very drying. So
Mhm.
whenever I've seen dogs that, like, people have been using that as a and well intended, I'm not saying they were doing anything, like, to be
Yeah.
purposely harmful, but usually their skin is a mess because they are covered in fleas. They have been
Yeah.
dried out, and
Ugh.
now they have no like, they just there's no happiness to that skin anymore. It's just dry and angry and sad, and it needs lots of help and oral preventatives.
Oral.
I don't mean to laugh because it is really terrible.
Yeah.
But I think the other part of what we were kind of saying that we were going to talk about a little bit is the food allergy part of allergies. So this is a really big topic, and I think we could probably revisit this like multiple times probably with
Oh, yeah.
food and stuff like that. But like I'm talking about, like, when you have a dog that is an allergy dog, the ones that are we're talking more about this when the skin looks really bad,
Yeah.
right? Not so much the GI. Although there is, right?
Mhm.
GI issues that happen with food.
Sure.
Um, and you probably see a good amount of that too, right?
And that's well, that's the funny thing, right? So, we had a conversation before this. I actually learned something from Sam today. I'll let you share it because I feel like every owner walks in being like, "Oh, my dog has food allergies. My dog has food allergies." And because I'm not a primary for that type of thing, a conversation usually, I'm just like, "Yeah, you guys probably have food allergies." But, I learned something very interesting here a little while ago, and I'll let you share it because, the prevalence is a little misguided.
Yeah, yeah, it's a lot lower than people think.
Yeah.
So we were checking the percentages just to be sure that we had accurate information, right? But it's like of all the dogs, like globally, like all dogs, right? It's like only like 1 to 2% really have that. But then of the dogs that have skin issues, it can be up to like 25%. So that is to say that it is something you should consider. It can absolutely be a factor, but it is not nearly as common as people think it is.
Mhm. No, I think that's, helpful for me because, like, how
Yeah.
many people come in all the time, they're like, "Yeah, my dog's got food allergies." I'm like, "Sure. I don't know. I haven't had a chance to diagnose it yet. I don't know your history, so we're gonna go with it." But,
Yeah.
I hear about it from a history more so than anything else.
And I think it's fair to say that just like in people, if you eat a certain way, there are certain ways that work better for your body, right? Like
Yeah.
there are certain ways that you eat that you give yourself nutrition that you thrive and you do better. That's not to say that if you eat poorly, you have an allergy to it. You know what I mean? And so if you're there are
Yeah.
certain things that you eat that don't agree with you, that's not the same as having food allergies.
Yeah, I had 3 beers last night. I don't feel great today. It's just like, well, it's like, I it's not like that I'm allergic to beer, it's just my body's like, You're old for this. Stop doing this."
Yeah,
So,
right, right, right. There was a
uh,
time where you could have had 7 and been like, "Let's go
I
to
love
class."
being here. Exactly. Oh god, how
No,
things have
it's like,
changed.
"You're old, Robert. What are you doing?" And then add a decade, and here I am.
Oh god, it's fun getting older. But yes, I think you make a great point. Like, just because your dog or cat doesn't react well to something doesn't mean they always have an allergy. It just means that it maybe wasn't the best thing for them in the first place. And dogs, and well, particularly dogs, getting the stuff all the
Yeah,
time. It's like it's their nature. They're very indiscriminate in terms of what they put in their mouth, and they often pay for it later,
yeah,
through one way or another.
yeah. And I would say that probably the other really important thing is that information's always also changing as far as, like, what we're learning about what you can do for the body through the gut and, like, how important your, like, biome and how important like your gut is to your immunity to everything else is so it's really something that's changing all the time. Like I feel like there's
Yeah.
new information every time I go to a conference. I probably could spend a day just learning new things and kind of digesting the information.
See, I like
It
you
was a
being so
pun. It
punny.
was a food pun.
I like that. I like that a lot.
But I think the biggest thing that one of the biggest misconceptions I think that I see from people like every day is they're like, "Oh, well, my dog can't eat grains." Probably that's the biggest one, right? Like, still
Yes.
now, even after all this time, they're allergic to grains. And I'm like, that's highly unlikely.
Yes.
Not to say that it's not possible. It is possible, sure. But it is highly unlikely. And it was put out into the ether as a marketing ploy that
Mhm.
has now actually caused quite a bit of damage to dogs.
Yeah.
And has really put this like rift between what people trust when their veterinarians tell them about food versus what XYZ company that really did not one diet trial. They didn't feed this food to anybody. They didn't check what happens to the dog or to the stools or anything else, but they put on there that they use chicken as their first ingredients, and so we should all feel better, spend a ton of money, and eat this unresearched food. And grain was made the boogeyman.
Yeah, I think honestly the number of dogs our cardiology unit sees that now have heart disease because having a grain-free diet is insane. Like, they're busier than ever because of I think it was I don't know if it was a fad and humans first, and they're like, "Yeah, our dogs are the same. We should do this for our
I'm
dogs."
wondering if it didn't come from the whole like everybody was like gluten free or whatever.
I think that's exactly what it was.
Yeah,
They're like, "Our dogs must be just like us," and they're not, and they have different nutritional needs, and because of this fad, honestly, like, it's caused a lot of dogs permanent, if not shorter lives
yeah,
because of it, so it's important to listen to your vets, and not just saying that because we are vets, but just because 'cause we're doing the research behind it, and there's some companies that do a really great job with research, but just don't
yeah.
believe everything you read.
Right. Yeah. And also too, I think one of the things that is the most frustrating for me with like dog food labels and stuff like that is they're very, very misleading and
Mhm,
they really play on your emotion because we show love with food, we celebrate with food, we like that's how at least for like my family and just like think about whenever you want to tell your dog he's great, you want to give him a treat, right? I mean like you want to show love with food. And so people like feel this like food shame, like, oh, I'm not feeding my dog, fill in the blank, whatever the like newest thing is, you know? And it's like, but that's not based in anything. That's based in your emotion, which is real. I'm not to say that to discount that, but like
mhm,
if they have not performed a diet feeding trial, your dog's the trial. If you're cool with that, then that's
mhm.
fine, but, like, that's what that is. Your dog is the one that we're testing it on right now, and it has had severe things have come from that, like, there was one food company that I guess there was, like, a excess of, like, camel meat or something, and they made, like, a camel-based food. It turns out that's toxic to dogs, but they never tested it. They just had this meat, and they used it. You know what I
That's
mean? So that's what
yes.
happens when people who don't know what they're doing formulate dog foods. I
Mhm,
mean,
and I think at the
worst
end of
case
the day
scenario.
yeah, but I think you make some great points, though, because at the end of the day, these people are trying to sell dog food. It's through
Yeah.
marketing, it's through branding. Like, there's one very big dog food that I won't mention that honestly people honestly pick because of the picture on their bag,
Mhm.
and it makes them feel like they have a real wolf at home. You don't, you have a pug. I'm sorry.
Right,
Like, it's just
yeah.
things have changed, genetically, they're different,
Right,
and your dog
right,
wouldn't last 3 minutes outside in the winter, so it's
right.
things have
Well, also,
changed,
dogs are not carnivores. They're not. They're omnivores. They eat everything. So,
literally
that's the
everything.
other thing too. I mean, they shouldn't be fed like cats. They shouldn't be. And they shouldn't be fed like wolves because 'cause they're not wolves. They're dogs. Not
Yep.
the same, you know? And so I take issue with that as well. But a lot of this whole, like and the reason we went down the grain-free thing, which is, again, a whole whole 'nother thing that we could talk about, but, like, is because a lot of times people think that their dog's skin allergies are because their dog ate a grain, and it is so unlikely. And if you want to know if your dog has a food allergy, often than not, it's actually the protein source that they end up having a
Yeah.
problem with. Like,
Yep.
not to say that it can't be the other things, but it's more often than not that.
Yep.
And you have to do a diet elimination trial. Just
Mhm.
like with people, this is another thing that really bothers me. Sometimes I'll see like somebody will have told somebody that they could get a blood test to tell them what food their dog's allergic to. It's not accurate and it's not
No.
true. And I don't like that because I don't like it's not just not accurate, it's not true. Just like in people, I mean, I know that there are circumstances and I think there's age things and so I'm not a human doctor so I'm not even going to get into that.
Yeah.
But I know in veterinary medicine, if you want to know if your dog has food allergies, you have to do a diet elimination trial, and there's only 2 ways to do that. One is to buy a hydrolyzed diet, feed it to
Yep.
your dog, give them that, only that, nothing else crosses their lips for at least 8 weeks, at least, if not 12. It can take up to
Yeah.
that long. And but usually and there are some dogs who, like, really don't get better till 8 weeks, like, you really can't short them.
Oh, yeah, I've had dogs
And
at 12 weeks. They start turning the corner, like,
yeah,
at 10 or 11 weeks, so
yeah,
you need to do for, like, the full 12 weeks.
yeah. And or you have to home cook for them. And you have to do it with the help of your veterinarian. You
Yeah.
can't decide what to give them. You have to actually cook a true diet elimination trial, and that is temporary. That is
Yeah,
not forever.
and the whole point of that is to choose a protein they've never seen before, like,
Mhm.
that's why it's challenging in the first place. That's why some of those the prescription diets are almost easier because 1, they're pre-made for you, they're nutritionally
Yes.
balanced, but, like, you can't go from chicken to turkey, they're too similar. You
Right.
can't go like, beef is not something like, you have to go, like, kangaroo, ostrich, alligator, something just that is not related to what they've ever had before. Because if they've
Yeah.
had it before, it doesn't count as a diet elimination trial, and that's the
Right.
tough part.
Right. And I think some very well-intended people know that maybe a little bit, and so they're like, "Okay, well, I had my dog on chicken, Purina Pro Plan, whatever.
Mm.
So I switched them to lamb." Well, that lamb that's over the counter still has chicken in it. I guarantee you.
Yeah.
So even though you've done something very well intended, unfortunately, we really haven't eliminated that because unless it's a prescription diet, they don't sanitize their belts in between. Like, so one food gets run on the same, like where the other foods have been run and there's potential contamination. So it doesn't count because some dogs
Mhm.
are that sensitive, like that sensitive. And then the other thing is that, they're not like single source protein foods. Like they'll have, byproducts or something else from it, from which is not a bad thing, by the way, too.
No, not at all.
So,
It's normal, it's
yeah,
expected. Just unfortunately, it's a consequence of how these factors are put together. They're not made to be that's why some of those prescription diets are so expensive because
they're
they do
very
isolate the
expensive.
proteins, and they have to make them by themselves in a separate area so it doesn't get cross-contaminated. Because otherwise the diet elimination trial doesn't work.
Yeah.
So,
And
it's
oh, go ahead, sorry.
Oh, no, you're good. No, you're good.
No, I was just gonna say, but the hydrolyzed diet, just because we're talking about it, so we probably should explain what that is.
Oh,
So
yeah.
basically, like, it is still your body uses the proteins in it as, you know, uh, nutrition, right? Your body can still use it. It does what it's supposed to do. But your immune system, they are broken down to the point where your immune system doesn't recognize it as something to react to. And so, they are still coming from, so there's a chicken hydrolyzed diet. And now what we've noticed is that there's also a soy hydrolyzed diet and a fish hydrolyzed diet. And you know what I mean? Because there are some dogs that are so sensitive that even if the source protein, even broken down to its little nano levels that the body shouldn't even shouldn't even react to, they'll still react to that. And then there's even an ultra hydrolyzed diet that's even broken down even more, and it's even
Yeah.
more expensive. But truthfully, that is probably, if you're gonna buy a commercial food, that's probably the gold standard, is the
Mhm.
ultra hydrolyzed diet to start with.
And by the way, to save money on these diets, buy it through myBalto, through our affiliates, and you'll actually get cash back on those bags. 'Cause honestly, they are very expensive, and
They're
you can
very
get some
expensive.
decent amount of cash back for those things. So keep that in mind. It's not a plug, but it is. It's but it's a way to save money. That's the whole point. That's why we're here, and also prevent your dog from having recurrent food allergies. So do it right, hopefully, and avoid those complications.
Absolutely, and I think too, think about it this way, the food, when you have your dog on a prescription food, or and I'm not opposed to people home cooking for their dogs. I'm really not, as long as they do it properly, as long as you make sure there are websites that will literally explain it to you how to do it, even websites that will help you to make a prescription diet.
Mhm.
So, you can actually, like, have your veterinarian sign off on a prescription diet for diet elimination or whatever else, and get a balanced and complete diet. You'll know exactly what you need to be feeding them. Now in vet school, we used to, on derm, they used to do a diet elimination trial of literally ostrich and rutabaga. Do you remember
I
that?
remember that. I remember that's the only reason I remember ostrich is, like, yeah, they chose, like, ostrich, there's, like yeah, it's ugh, gross.
Ostrich and rutabaga. That's it. Your dog was to eat nothing but ostrich and rutabaga 12 weeks.
Yeah.
So this is obviously not balanced and complete, right? Like, let me just say, if you're giving your dog meat and a veggie or a starch, whatever
Mhm.
rutabaga would be, I don't know. It's kind of like a potato. But but if that's what you're giving them, that is not a balanced and complete diet. And
Mhm.
dogs do have different amino acid needs than we do. So like
Mhm.
you really do need to make sure that you're feeding them everything that they need. And so that I will plug to say like this is a 12-week part of their life. If you're home cooking for them for a diet elimination trial, that is not forever. So if you find out, wow, they're doing great and it definitely was a food mediated allergy, then you start to challenge them. You start to
Yeah.
let them you have a home base, you know how to get them back, but then you start saying, "Okay, can they have, this thing? Can they have that thing?" And then you can get them to a more complete diet.
Yeah, exactly. It's a temporary transient thing that should not be lifelong, because otherwise, yeah, your dog's gonna have nutritional deficiencies and have other problems down the line.
Right, right. And the other thing too that I have seen a lot of people do um is that they kind of say like, "Oh, well, I feel bad that he eats the same thing all the time. So I give my puppy chicken this time and then the next time I get fish and then the next time I get." Don't do that because then we don't have a novel protein.
Exactly. Don't keep switching the diet. And honestly,
Yeah.
our last plug for this will be see owners like they're like, oh, they won't eat because like I had chicken from them, they just won't eat, and I switched it 4 other times, and it's like they won't like they try it for a week and they switch off. I'm like, they will eat when they're hungry. At some point, like just leave it there. They will eat. I promise you, because they got to eat to live. They will. There's very few dogs I've seen that have not done that. There's a few stubborn ones, but for the most part, if you feed them the same thing and like, all right, I'm just not gonna feed you anything else, they eventually will eat.
Yeah.
So it just takes time.
Yeah. Well, and also too you have to think about like we are kind of like they're kind of training us like, well, if I don't
Mhm.
eat, then I get reinforced by getting the yummy thing.
Exactly. 100%. They're
Yeah.
smarter than they
Yeah.
let on. So, and they're smarter than us sometimes. So, they're conniving little devils, but we
Mhm.
got to beat them at their own game.
But doesn't it amaze you because there how many times that you've checked blood work on a dog that hasn't been eating, from what we know, for, like, 3 days, and it's still totally normal?
Oh yeah, it happens all the
Like,
time, and it
blood
drives.
blood sugar, I mean, blood sugar.
Oh yeah, it's like owners all the time are like, yeah, their blood sugar's got to be low by now. I'm like, you'd be surprised. It's
I'm
probably
like,
just
"No, it's
fine.
probably not, it's probably totally
Yep.
fine."
Yep. So it's the potassium will be down at some point, but yeah, it's
Right.
crazy how well their glucose regulation is, and they got plenty of fat stores to help with that. So don't
To
worry, they're in good
to
shape.
keep it fine. But yeah, and I do think that getting to the bottom of food can be a really, really important part of an allergy workup, but it takes commitment, and I think that a lot of times it's an interesting dichotomy because I think on the one hand, it's one of the first things that owners say, but one of the
Mhm.
last things that they do properly.
That's a good point. Actually, yeah, I have to agree with you because I think people do it because they think it's cheaper initially
And
than
they think
doing
it's
like
gonna
some of
be
the same stuff.
easier. Yeah, like,
Yeah,
it's, "Oh, well, if I just switch their food, then this will all go away." And I get that. I would want that to all go away too. That'd be awesome if that was true. But then they start to realize, "Oh, wait, to do a diet elimination trial, that means if I have 3 dogs, this dog
that's
can't eat anybody else's dog, or they can't eat my cat's food, or they can't eat, like, anything." Oh, and then when it comes to, like, preventatives, now you gotta try doing, like, a topical, or you have to do something else because they can't give them anything. So, I mean, it's
yeah.
that strict.
Yeah, like even medications, carprofen or Rimadyl or whatever people that it's a beef flavored tablet.
Yeah.
Um, that will cause them to relapse if you give them that while they're on these medication or trying to do a diet trial. So it's just rawhides, all that stuff it's gotta go. No people food, gotta go. Um,
You can give them marshmallows to put their medicine in.
I did not know that.
It's just sugar.
I just it's just so funny that you're like, you can give them marshmallows.
True.
I didn't I'm gonna actually recommend I did not know that. I'm gonna tell that to my owners 'cause that's a really good idea. That's a brilliant idea,
Marshmallows.
Sam.
That's how you make a little pill pocket with a marshmallow
That's fine.
until they're on
Uh,
to you, and then they're like, "No."
what the hell? That's really
Then you
funny.
learn to pill a dog.
Yep, and we'll teach that in our next podcast.
Yeah. Yeah. Although my dog is I could actually make a video of pilling a dog because it's he could care less. He's like, "Oh, cool. You gave me attention.
Mine's peanut butter. Peanut
How did
butter, he'll
you?"
eat anything. So,
I don't even have
love
to. I'm
that.
just like, "Gus, here."
I love labs.
Yeah,
They'll eat a bird.
he's usually, actually, I just throw his medicine on top of his food, and he's fine. But if I forget, then I'm just like, "Down the hatch."
That's
And
good
then
enough.
and then a lot of times I feel bad for him and I give him a treat, but I don't actually have to.
God, he cracks me up. He's a good dog.
Yeah. He really is. He's the best dog. He's such a sweet boy.
Yep.
And the thing is, it's so funny is, like, you just can't get him tired enough. This is a total, like, nonsense, like, totally off topic, but, like, he started throwing the ring for himself. Like, he'll get
You guys won't
outside.
play with me. I'm gonna
I
do it by myself.
seriously, I mean, like, because 'cause I'll throw it for him for a while, but then I'm like, he can go forever, right? And so, like, all of a sudden, I'll just notice him outside, and he's just, like, flipping it up in the air and then, like, running around, and I'm like, "Oh, okay, he's learned how to play with him how to throw the ring for himself. That's perfect."
Only children. You gotta love them.
Yeah. He's like, "I mean, okay, I guess you guys are busy."
That's so sad. I wanna see a video of that one day.
But I will say, so there is another component to the diet. I'll definitely give you that, by the way. Sorry. Took a second
Thanks.
for me to
No, you're good.
compute what you just said. But the other part of the diet thing is, so there are diets that you can put your dog on that are derm diets that are not the hydrolyzed diet or even one of the single source protein diets, because there are also those which a lot of people use too. I don't use those as much, so I feel like I don't have as much to say about them, but like they're definitely part of the realm of when you're working up a,
Yeah.
a skin allergy. I usually just go straight for the hydrolyzed. Um,
It's a great
but
choice.
what was that?
It's a great choice, yeah.
It's what's always kind of worked in my hand. So again, like part of it's just like, what do you do? What's your thing? How do you go
Mm,
about it? But it's not wrong to do it a different way. In fact, and I think the dermatologists get way more into that kind of stuff, than we do. Because at some point when things get that frustrating, a lot of times they're also working with a dermatologist. But but there are like derm diets that are just for those dogs that failed a diet trial, let's say, like a true elimination trial, like they really didn't see much of a difference. It didn't really get better, or it got better, but it didn't really fix it. And there's still the seasonality to it. And you're like, I really think my dog is primarily an environmental allergy dog, which is kind of like Gus. Like he really is
oh,
an
poor guy.
environmental allergy dog, right? And it's not terrible, but so I actually put him on like a dermatologic diet that is supports dogs that have environmental allergies because it has like more omega-3 fatty acids, and some
Nice.
of them have different things in them. I don't know what's in all of them, but I mean like Hills has one, Purina has one, and I think Royal Canin is coming out with one. And it's interesting, like when I was at the last meeting that I was at, they were saying that they'd seen a decrease in how much medication they had. Some of these dogs were even using like things like Apoquel and stuff like that, being on these diets, not because they have a food allergy, but because the food has stuff in it that helps to support the health of their skin. Does that make
Yeah.
sense?
No, that makes perfect sense because that's the reason why dogs have environmental allergies most of the time. It's their skin barrier isn't healthy,
Mhm.
and it predisposes them to those allergens, unfortunately. So eating a diet that helps with that, hopefully that reduces the amount of allergies they have.
Right, exactly. And if you think about allergies and plenty of other things, right, are just inflammatory diseases, right? And so
Mm.
anything that helps to decrease inflammation, so things like omega-3 fatty acids and stuff like that are natural anti-inflammatories. And so like they are definitely going to help when you have a diet that, has that in the right amounts.
Yeah,
It's helpful.
agreed. So,
Yeah.
but I think, that's about it for
Food.
environmental allergies that I got, right?
Yeah.
So, we'll go from there. So,
Well, I think the take home really is just that like it can really be a very important thing that you need to figure out, but it is a commitment to do it the right way, and it's probably not grains.
subtle hint.
So talk to your vet, get on a balanced and complete diet. And no, definitely I think if you can commit to a diet elimination trial, that you should do it. But there's some other things too to consider when you have chronic skin issues too, to make sure that there aren't other things, right? So like a lot of times they're gonna check like thyroid, they're gonna, you know what I mean? Like there's
Yeah,
other things that can interfere. So whenever you have a dog that has these chronic issues, it is so frustrating. And I really do think it should be like all the above. Let's get them on flea preventative. Let's see if food is a part of it, if you have the money and the ability to do it. If not, and you can get it under control with the environmental stuff like we talked about last time, I think that's
Yeah.
totally reasonable too. But I do think that for those times where you're like, you know what, we just got to figure this out, and you gotta have a all the above approach, I think.
Mhm. No, I agree. It's, with allergies, I think you have to be in it to win it. It's,
Yeah.
like, because otherwise your dog is miserable, or dog or cat are
Yeah.
miserable.
Yeah.
It's not fun to watch them itch all the time, and you'll be in the ER at some point for ear infection, or I had a, French bulldog in this last week that had such bad allergies, it's pardon my French, its ass is on fire because how, like, red it was and its paws and just got a lot of allergies. Actually, it's a systemic disease, that's why it's part of the reason it has allergies. So it's, I think it's cushingoid, so unfortunately, it's making it worse. So,
Really?
yeah. So it's,
Oh,
just something to check, like I said, have those conversations with your veterinarian, do blood work it up the right way, and then get a handle on it early. Whether it's
yeah.
food, environmental, or flea, do it sooner rather than later because that way your pet will be better off for it.
And truthfully, like, I think you plugged this last time. Get insurance.
Mhm.
This is a
Yeah,
disease
do.
that's going to emerge early in their life in
Mhm.
most cases. If you
Yep.
have a Frenchie, they are going to have allergies. If you have an
English
English
bulldogs.
bulldog,
Yep.
they're going to have an allergy. A
Yep.
lab, I hate to say it, but a lab, a golden retriever, a pit bull. I mean, there is a list of dogs that you are just going to expect it. I feel like Westies, they all have bad
Yeah.
skin, right? I mean, there's
Cocker
more.
spaniels,
Cocker spaniels. Oh my gosh.
atrocious.
Yes.
So
Shih
just
Tzus.
yeah, there are really a lot of dogs, but get insurance early.
Yeah,
Like
and
get it
all the
early.
doodles, all the doodles. Every one of the doodles.
All the doodles.
It's true.
It's
Every
true. It's true.
doodle.
It's fun.
Yeah.
The
And then
it's the
if you
ones like
have one of those dogs and they don't have allergies, count yourself lucky, be happy, and then cancel your insurance, but have it for
mhm.
the first
We're
2
trying
years.
to tell you how to beat the system. We're trying to help you.
Yeah, exactly. We're really trying to help. We really, really wanna help. But yeah, so I mean, that's pretty much allergies in a nutshell right there, I think. All of the above, be aggressive early, and get help paying those bills.
Mhm.
My
Do it
Balto
early.
and insurance.
Yes, they work well together.
They do, because my Balto is not an insurance. Let's just put that out there now.
There it
But
is.
but yes, we are here to help. And if you have questions,
Send
you
it
can
to podcast@mybalto.com.
exactly. Podcast at mybalto.com. We will answer your questions. We could dedicate a whole podcast to you. If you disagree with anything that we're saying, we like that too. Hey, we
Yeah.
if we
We'll
said
do
something
some
and you're like, no, I don't agree. Or, I mean, that's fine. Let's have a chat about it. We
yeah,
don't
that's
mind.
half the fun. Yep.
Exactly.
We don't mind, bring it.
We don't mind. No, we have the thing is that like we are always here to learn, right? We don't think we know everything, but like this is the stuff that, we've taken a long time to learn about, and what we've seen, bear out in life based on there's a lot of stuff out there that's bad information. And I see a lot of things on second opinion. So I can tell you that I really feel like this is the way. Early, aggressive, all the above. Get it going. Have insurance.
This is the way. For all you Mandalorian nerds out there, that was for you.
I didn't
So,
get it.
Sam, you're killing me, Smalls. Now we have to end the podcast.
Okay, this has been the Pause It Podcast. I'm Dr. Dawson. Ooh, Sam, Dr. Sam. See, there
And
you
I'm
go.
Dr. Robert.
Got me. Dr. Robert. Thanks so much for listening, and we'll see you all soon.